Hello, Dr. Dave Hindmarsh. What I want to do in this video is just talk you through the Type 2 Diabetes Path to Remission Programme. Now, you may have seen in the news and media about a study called Direct, which used ultra low calorie diets to reverse diabetes, promoted significant amounts of weight loss, and then people subsequently put their type 2 diabetes back into remission. This is brilliant for your overall care and health because then there's other links in terms of affecting your hypertension, so your blood pressure levels, and also your overall health. And again, there's been some really good news articles about this showing how the studies can work and having make a real good life impact. So the group is over a year, and this will hopefully be hosted locally within the area. It covers 3 phases. So your first initial phase for the first 12 weeks, you're on 800 to 900 calories a day. So that's a small amount of meal replacements, which are given free to you. And I'll give you more details later on. Over that time, you're gently reintroduced with coaches about how to eat healthily so that you don't basically pile on any weight that you've lost. So inclusion criteria, you have to be keen. That's the real big thing. It's a huge change and it's a huge ask for you in terms of your time. So please don't sign up for this lightly. You need to be aged between 18 and 65, have diabetes diagnosed within the past 6 years, and your BMI needs to be over 27 or over 25 if you're a Mabame background. And you must have attended your monitoring. So that's where we do the bloods, and you'll often get a phone call afterwards just to check that everything's going okay. Likewise, with regards to your HbA1c, that needs to be within certain ranges. So above 43 if you're on diabetic medications, that's slightly higher at 48 if you're not on anything. Regardless, they don't want over or controlled diabetes. So if it's over 87, they'll exclude you. Okay, so we'll make sure that you're well within a sort of a sensible range. Exclusion criteria, unfortunately, they don't take insulin users. If you're breastfeeding or if you're planning a pregnancy, they won't sort of allow you on it as well. And also if you've had a heart attack, stroke in the past sort of 6 months or any quite significant renal failure as well. Also, unfortunately, if you've had bariatric surgery, you're not eligible for this because you've probably been given dietary advice already. And also, if sort of we need a consultation with one of us just to make sure that you're happy with what this entails and whether you're happy to go through with it. So this just gives you a rough flavour of what it's going to sort of look like over the next sort of year, all being well. And they will take you week by week, step by step in terms of building up and how you are able to sort of impact from this way. As you can see, it sort of goes from the green bit as you sort of getting started off and then sort of converts through as you slowly build into more eating back to a normal lifestyle. So the diet replacements are based on Exante products and they're free. They're basically chosen because they've got a wide variety of products, including vegan options. And effectively, you're either given voucher codes or sort of like basically ways to order it online, depending on what you want. And then you can sort of order to your heart's content, obviously keeping within that dietary restriction. I'll leave a link below so that you can have a look at the products, as there may be some that will sort of really key in with you. So you'll get a bucket load of resources to help you along your way. You get workbooks, trackers, recipe books, and other bits and pieces as well, just to really try and help you on your journey, all for free, all to help you sort of reverse your diabetes. So you've got this presentation. I'm going to leave some links below so that you get a more detail of what the program will look like and also have some sort of patient experiences and how people have really affected themselves. Why I'm really keen of this is that we can get you off some drugs. They want you to stop the medication just as you're about to start it, okay? So they will talk you through, when to stop things, but what we need to do is effectively have that chat about what medications are suitable to stop. So really, if it's 1 or 2 agents, it may be a case of we can just bin them off, i.e. if you're on, say, like metformin and a glycoside or something like that, we can just stop it straight away, which is amazing. Likewise, your blood pressure is likely to drop as you've significantly altered your dietary intake. Due to this, we need to make sure we identify what medications are safe to stop and how we can monitor that and do it in a safe manner. So if you're keen, please, it's either me, Dr. Hindmarsh, or Lindsay Spires, our wonderful nurse practitioner, and we'll be messaging out links to set clinics so we can discuss this, okay? So that's the initial bit. Once we've got we're going to send the referral straight away, and we'll engage with the team to try and get a local group set up, because I appreciate this is going to be difficult, and I don't want to add in extra travel if we don't have to, i.e. somewhere in and around the area. There will be evening sessions so that it shouldn't impact on work, because if you can imagine the age range that we're hitting, the majority of you are going to still be working from that point. So 3 things. 1, telephone appointment initially with, as I said, myself or Lindsay, just have a chat through, have a look at your medications. What can we start? What can we, what do we need to be aware of? And also start to think about the monitoring. From that consultation, if you're happy, I'm happy, then we'll send that referral off. Second part, the team who are running this will then get in contact with you. They'll probably do a telephone consultation just to make sure that they've got all the information, that we've not missed anything else out, and that you're happy with what medications to stop and when. Once we've got confirmation of numbers and that you're keen, we'll then give more information about where the local group will be and when it will be happening. And that will be sort of dictated to by what the referring to or what the team have got available and when we can get this all started. Ideally, I want this set up as sooner rather than later. So if you're getting a text message that's sort of linking to this, please make sure you book in for that initial consultation. If not, give us a shout, and then we can make a plan from there. Dave Highmarsh, Eaglescliffe Medical Practice, thank you for your time.